Dr. King, take us through a number of the important roles on your PH team.
We have 3 full-time physicians that are dedicated only to pulmonary hypertension and have years of experience, so very much experts in the field. We have a number of nurse practitioners, including myself, and also a couple of physician's assistants that work in the inpatient side. And we're all responsible for the medical management of the patients. We follow them in the outpatient clinic, which is where I work primarily. And then we also have a team that works in the inpatient side for those patients who are admitted to the hospital. And our physicians, of course, are the leaders of our team and direct the activities. And we work under guidelines, established guidelines for pulmonary hypertension, both from 2013, the NICE guidelines, and then also more recently in 2015, the European guidelines. We also have what we call PH program coordinators. And the Pulmonary Hypertension Association really coined that term as part of the accreditation process. In our particular program, the PH coordinators are nurses, and we're very fortunate because we have 3 full-time nurses that are dedicated only to the care of patients with pulmonary hypertension. They split the alphabet, so they each have a third of the patients, and it works out really well because they're able to get to know the patients and get to know their families. Whenever the patients come into clinic, they are in the room and they are participating in that visit. And then they also address all communications that come in between clinic visits. So the nurses really are the backbone and keep the place running for sure.
They have a good way of finding things out that maybe patients don't want to tell their doctor.
Absolutely, yes. As a matter of fact, I may be in seeing a patient and I get one story and then the nurse comes in and says, "Oh, no, Martha, this is really how it is and what's going on." So the nurses are fabulous, and just that they manage so much on a day-to-day basis. We also have pharmacists that we work with. We have an inpatient pharmacist who is very helpful for the patients who come in on IV therapy. When a patient, in that case, is admitted, our pharmacist calls the specialty pharmacy to make sure that the dosing is correct, the dosing weight is correct, and that everything is the same as what they have been doing at home. And then we have also 2 pharmacists that help us manage patients' anticoagulation, and they monitor their, what we call the INRs, and their Coumadin dosing, and that's particularly important for the CTEP patients. So we're very happy to have some dedicated pharmacists. We also have a social worker who is very integral to our team, and her responsibility includes helping patients with financial issues and transportation issues, I would say, most commonly. Oftentimes patients have to stop working because of this disease as it progresses, so the social worker is very helpful in helping those patients through the process of getting on disability. And also when patients have to choose insurance plans, we have the social worker work with them to make sure that they choose a plan that allows us to see them and allows them to continue on their therapy.
And then there's research, and they're obviously busy.
Yes, the research staff is very busy. Each research coordinator has 2 or 3 clinical trials that they're assigned to, and so they manage their own clinical trials. Once the patients are identified by the provider as being a good candidate, then the research coordinators bring those patients in and do a formal screening day, and we go through very carefully all the exclusion and inclusion criteria to make sure that patients qualify for that study. And then once they're consented, the research coordinator coordinates all their visits and makes sure that all the steps are done correctly and all the reporting, if there's any adverse events or anything, are all done. So yes, the research coordinators are very busy and very important to our team.
Can't do it without support people as well, right?
Absolutely, and we have some fantastic support people. We have 1 full-time medical assistant and then another one that helps out as well. And their responsibilities include basic things like getting vital signs and getting the room prepared for the next patient, but they also do all of our 6-minute walk tests and our spirometries. So those are things that patients do very frequently when they come into clinic.
Cliche, but truth, it really does take a village.
It really takes a village. Yes, we could not do it without all of these people in place.
Very good for the patients here in Texas.
Yes.